Deputy Shortall, Graham, colleagues, it gives me great pleasure to be here to celebrate the 30th anniversary of the Health Research Board. The Health Research Board has played a huge part in my career, and I have great affection for it and huge respect for it. I'm here today, I'm Dean of Dentistry at the University of Leeds, but I also have an adjunct appointment with University College Cork, where I work with a very capable team of researchers, and I've worked at the Oral Health Services Research Centre for longer than I'd care to tell you, and I'm not going to tell you, but we've developed a very good team there. And our core mission is to improve the health of the population through the promotion of excellence in epidemiology and health services research. And the message I want you to take away from my presentation today is the key role that the Health Research Board has played in developing that centre and in developing research for policy in Ireland. So, the Irish population has access to water fluoridation. The Health Fluoridation of Water Supplies Act was passed in 1960, and that's had a great influence and shaped the type of research that I've done throughout my career. Currently, 73% of our population drink fluoridated water. Where there's action, there's also reaction, and not everybody supports water fluoridation. There are a few very vocal opponents to water fluoridation, and it's very important that we listen to their views and that we continue to do research to ensure the effectiveness, the continuing effectiveness and safety of that public health measure. Now, the risks and benefit of water fluoridation, the risks are, the acknowledged risk of water fluoridation is that of fluorosis. Fluorosis presents as paper white patches or fine white lines of the teeth, which you can see here. That's the risk of water fluoridation. But of course, the huge benefit is the prevention of caries. Prevents currently, in current populations, about 35% of caries. So historically, at the time when fluoridation was introduced in Ireland, your average 15-year-old had 9 decayed teeth. That would be unheard of today. But still today, even though this disease is preventable, it's the #1 most common chronic disease known to man. And that's according to the WHO Global Diseases study published in 2010. So it's something that affects us all at some stage throughout our lives. So we've studied it a lot because of the situation in Ireland. Now, our studies over the years showed that this condition, fluorosis, increased in prevalence between 1984 and 2002. You can see there in 15-year-olds it went from 5% in 1984 up to 36% of 15-year-olds had some level of fluorosis. Now, most of this was not of aesthetic concern. However, we did alert the Department of Health to it, and as a result, fluoride levels in water were reduced from 1 part per million to 0.7 parts per million in 2007. Now, I have to add that it probably wasn't the water fluoridation that was doing this, but during the period of study, fluoride toothpastes became very commonly used, and of course, there were 2 sources of fluoride then. So what of this change in water fluoridation level? We were very keen to measure the effectiveness of that, and this is where the Health Research Board came in. And we couldn't have carried out this study to measure the impact of the lowering of water fluoridation levels on the health of Irish children without the Health Research Board. So we wanted to know whether that lowering of water fluoridation levels continued to exert the preventive effect on our nation's teeth and also managed to reduce the level of fluorosis. So we conducted the study we did the first tranche of fieldwork in 2013-14, and I can give you a very superficial quick look at the first lot of results, which show here amongst 6th class children, that would be 12-year-old children, that actually the level of decayed teeth in the fluoridated and non-fluoridated populations continued to decrease even though the level of fluoride in the water decreased. So you can see the comparison there between fluoridated and non-fluoridated areas in Dublin. Dublin is fully fluoridated, of course, but the comparison is between fluoridated and non-fluoridated areas in Cork and Kerry. So fluoridation continues to exert its preventive effect, and that's a very simplistic presentation that I'm giving you there today because of the time available. But of course, it's not simple. We have to measure the exposures to fluoridated water of each and every child in the study. We have to look at the sociological determinants of decay. We have to look at children's oral hygiene, how much toothpaste they're using, what kind of diet they have, what kind of pain levels they have in fluoridated and non-fluoridated areas, and so on and so on. So there is a lot of complexity in these studies, and they must be properly resourced to ensure that they're high enough quality to base our policy on. We also wove into it, thanks to Ivan Perry, who asked very nicely, measurement of children's height and weight to add value to the study. We had first done a national survey of children's height and weight of 20,000 children on the island of Ireland in our national 2002 survey. So this will provide some a second cross-sectional study of that to give us some trend data. So what of the fluorosis? Did we succeed in reducing fluorosis? Well, we have to wait. Children that were born after the change are now age 8, and now in 2016-17, thanks again to the support of the Health Research Board, we have nested a cohort study within that study, and we will look at the children once the permanent teeth have erupted, and that field work is going on as we speak. So come back next year for the answer to the fluorosis question. So at this point, I just want to show you, give you an overview of how important the Health Research Board funding has been and what it's leveraged. It's not just the research in itself that the Health Research Board has been important in supporting. So you can see here we started with a question from the Department of Health. We wanted to do national surveys of children's oral health. We wanted to see what is happening. That allowed us to apply to the Health Research Board for research funding to add value to that epidemiology. And we did studies on fluoride, studies on the aesthetic impact of fluorosis, study on fluoride in saliva, studies on adults, studies on infants, studies on children, women, laboratory studies and clinical studies. And we became experts in fluoride, world experts in fluoride. And we are consulted widely on that issue. So at the same time, all of that expertise and the team we developed around that were able to apply for EU funding under the different framework programs. And we were very successful in applying for EU funding. I think because funding is tight in this country, it makes us very sharp. So we had funding for health service studies, efficiency in oral health care, the evaluation of oral health services in Europe. Then we had FLINT, which was fluoride ingestion from toothpaste, to look at what level of fluoride children in Europe were ingesting from toothpaste. So what this did, if you go back towards the arrow pointing back towards the Department of Health, the Department of Health got their safety and effectiveness studies on the fluoride. They got Irish evidence for Irish policy. So it was absolutely appropriate evidence to base Irish policy on. And they got the impact of managing to sustain this very successful public health measure based on that evidence. So we continue to enjoy the benefits of water fluoridation. If you go back towards the international side, our Irish profile, our profile as researchers from Ireland is high internationally. We've developed very good partnerships, not just in Ireland, but internationally, and we have provided also evidence for international policy as to the safety and effectiveness of this public health measure. So we've developed capacity, we've innovated, we've developed people, we've developed health economists, we've developed statisticians, we've developed sociologists and psychologists, all with funding from the Health Research Board. So we have developed huge skills in Ireland, and we've also developed such skills that industry now come to us to run clinical trials, and we run a very profitable business running commercial clinical trials, which helps to support the other investigator-led research. So it's a whole system, and it's held together by Health Research Board funding. We also do work on databases. You heard Deputy Shortall saying that I'm PI of an EU-funded Horizon 2020 programme grant. That's a 6 million grant, and that's based on big data from claims databases. But the seed of that came from Health Research Board funding to look at national databases. We looked at the Dental Treatment Services Scheme database, and we also looked at the prescriptions database. So we did a lot of work on those. So again, the department got its Irish evidence for Irish policy, it got impact from it, and also that international reputation went in the other direction. And again, the skills and the collaborations and the people were all developed. So our impacts are many, and here are just some of them. I won't take your time to go through all of them, but they've been far beyond oral health. The impact has gone far beyond that core funding the Health Research Board has provided. But we could not have done what we did without the Health Research Board. And I look forward to many more years of collaboration with the board. And just like to wish the board and all the staff at the Health Research Board a very happy anniversary. We're very grateful for your hard work and your support. Thank you very much.